All right, Matthew Holt here with a THCB Spotlight. I'm talking to Derek Streat, who is the CEO of Dexcare, which relatively recently closed a pretty decent funding round from Iconic Growth Partners and has come out of Providence. But Derek actually started back in healthcare. We were just chatting offline at the Health 2.0 conference with a company called Medify back in 2011. So he's been doing healthcare for a few different companies now for a while, Derek.
Yeah, for sure. Yeah. Thanks for having me, Matt. It's good to see you again.
Yeah, absolutely. Well, look, let's chat about the present rather than the past. So Dexcare came out of Providence, now working with a bunch of other hospital systems, and you're kind of doing inside hospital operations that match buyers and sellers kind of marketplace, I think. What I'd like you to do is explain what that means, what you're actually doing, and how that works for either the consumers or the providers in the organization. What does Dexcare do for those organizations?
Yeah, absolutely. So I'll kind of go. I'll start at a higher altitude and kind of go down levels to make sense of it. So Dexcare is first and foremost a data-driven intelligence company, and we focus 100% on making healthcare access easier for everyone. And when we say everyone, we really mean it, and we have a pretty unique view of what that means in the space. So to us, everyone includes consumers and patients. So consumers, they're not yet patients at a particular health system. It also includes providers and includes health systems, because access really doesn't work for them right now either. And I'll get into that in a moment. The key offering we have, the platform we have is what we call an orchestration platform, and it coordinates and orchestrates the demand side of healthcare. So that's the consumers and patients, with the supply side, which are the resources in the health system. So they could be clinics and providers and things like that. And we do it across all lines of care. The way we do that orchestration gets into kind of the unique aspects of the platform itself. So there are kind of three aspects. Think of it as sort of three legs of the stool here. The first one is we have a set of technologies we call digital discovery solutions. And what these do is these ensure that the care options offered by health systems, who are our customers, users or patients and providers, ensure that those care options are more easily discoverable by consumers and patients anywhere online. So we kind of upend the belief, if you will, that many kind of health systems have, that their website or their app is a digital front door. That's not really the case. Right. The digital front door for most things in life is Google, or where somebody happens to advertise or promote us to. Maybe marketplace is a little bit out there, but it's really kind of those search engines. And so we ensure that things like real-time availability, the various care options, ways to kind of aggregate them together and present them in ways that are easier for people to find, that rank higher on those search engines. All those things happen so that health systems are then able to get more of those consumers and patients to serve. The net of that piece alone, I'm happy to double click on it later if you want to, Matt, but the net of that piece alone ends up attracting 20-30% net new patients to health systems. What we found was that you can do a good job at kind of amplifying or creating these consumer-friendly experiences for health systems, but it kind of exasperates another issue, which is dealing with the capacity or lack thereof within the health system. Particularly over the last couple of years, this is a real issue. It ties directly to workforce, all that stuff. And so that's where we added the other two components. The first is intelligent navigation. So once that technology is all about ensuring patients are routed to safest and best care options. We tie deeply into the EMR, deeper than what people typically think of when they say integrated into the EMR, to understand what's going on with those patients, what their histories are, what they need. And then the second piece is what we call, and the last piece is what we call capacity optimization. And so what that does is that automatically allocates the health system resources when and where they can be most productively employed. And that on that side of the equation, often the decisions that are made are about what's going on with the providers and what's going on with the health system. So an example, when you pull this together, would be, let's say I'm a patient and I need some care. I've got certain preferences. I've got certain reason for visits. I've got certain history. Those are all data that we'll look at, and we'll consider that in how we may match you up with care setting, modality, provider, et cetera. But then we'll also look at what's going on with the providers. So who's at capacity? Who's close to being burnt out? Who's burnt out, right? Who is best qualified to see these types of patients versus that? And then finally, we'll factor in that health system data, right? And so we'll look at utilization patterns across the health systems. We'll look at their service lines, who's being taken care of, who's not. We'll look at the cost of their resources. Often, a patient can be taken care of just as well clinically by a nurse practitioner or an MA versus an MD. That saves everybody time and money in the system. And so when you kind of put all that together, you end up with a system that truly does improve access for patients, providers, and health systems, because the through line is time, because patients are able to find the care options, if you will, more that they can get access to more quickly, because there's more of them now displayed to them where they're going online. Providers have more time to see patients that are most appropriate for them, because they're not burning time that they're not qualified with, patients they're not qualified best to see. And health systems end up saving time, because the average visit durations go down, because we just have better matches. And for a health system, as you well know, Matt, in this environment right now, incredibly financially challenging for health systems. They need to be able to grow, and they got to be able to do it sustainably. And so this system ends up helping them by helping them find patients, and then helping them kind of extend the capacity of those resources and route to top of license and things like that. They can reduce that time or visit duration, which lowers their marginal cost of delivering each visit.
Okay, so that sounds that's great. That's a pretty comprehensive overview, and you're trying to do a lot of different things.
Yeah.
So let me start with the sort of, we'll start to the edge, and I'll go to the core of the business later. But kind of big picture at the edge. What's your sense of how much business sort of comes by people looking online for doctors and hospitals versus traditional way of you have some primary care doc, or maybe you're going to a retail clinic or whatever? You're somehow sent into the system and you're referred around to the specialist that the GP knows. Where are we in the sort of people going directly to to a marketplace of healthcare systems and picking the best one off Google versus the way they always got there? Where is that transition?
It depends on the type of care and the service line you're talking about, right? So we know that for what we call this provider agnostic care, so this is type of care, right? We all use it. We've got a pain. It's gotten to the point where, fine, we'll go see a doctor now about it. Maybe on our lunch hour or something like that. We don't really care who the provider is. We just want this thing fixed. Give me a pill, give me a thing, to get it done. This is urgent care. This is retail care. A lot of the virtual care, primary care, a lot of those things. So in those cases, almost all of that care is I will say kind of virtualized in some way, meaning most of it actually goes through a call center, right? We've got we're still trained to call people by the phone. It also though includes folks that we can learn about online, maybe self-schedule online as well. But that kind of provider agnostic care, walk-ins certainly happen as well. But even there, you can probably attribute some like brand recognition or things like that to things that you see or learn about online, or you go to a search engine and urgent care near me, the Zoom care thing shows up, and then now it's down the street, and then you walk into it that way, right? So there's some sort of digital enablement that happens with almost all that care. When you get into specialty, kind of where you're going there.
But before you leave that one, how much of that comes from it's just me, I'm searching, I have nowhere to go, versus, I'm pretty sure that both my health plan and my wife's employer had a different option for telehealth, for urgent virtual care. Do most people go to that, or do most people not bother with that and go straight to Google? Great. But I clearly remember one of them had my health plan had American Well, and my wife's employer also had telehealth somehow, and I don't know. I could have gone to one of those. I don't know which one I ended up using, but something happened. Great.
Yeah,
I'm wondering who owns me at that point.
It's a good point, right? And it really comes down to kind of it comes down to what you as a patient are optimizing for, right? So if it's a pain that's it's bothering me enough, I'm just going to go get it taken care of now on the lunch hour. The majority of that traffic are things, people just searching for things on Google, right? Just like we do about anything in life. The more serious it gets, the more you'll go. It's a good call out you made for kind of the payer portals, right? It's a good call. Those are used as well to figure out who provides coverage. But really, most of the stuff you'll find online too, even if you start in Google, will get to some sort of RTE or real-time eligibility or things like that as well to deal with that. So again, still, when you go back to low acuity provider agnostic care, the majority of that care is at least initiated online in some way. Now that may very well lead you to a phone number that you then call, or a listing of an address, right, that you then walk into. So also the majority of care is not delivered virtually, but the majority of it is discovered virtually for that level of care. It's very different with specialties, right? And this is a challenge with healthcare, quite frankly, because I think, as we all know, for a lot of specialized care, right, we do the first thing I just mentioned. If you're older like me, you still think, having a PCP matters, right? And so we do that, and you go in, and then eventually, if you need some specialized care, then the whole system, right, is set up to intentionally limit our ability to get to that actual specialist. So the specialty care is very, very referral driven right now. We think that needs to change. Not that care needs to be, you need some limiters here to make sure that care is appropriate, but you can, I don't know if this is where you're going with the question, but you can look at, there are a number of spaces that are certainly specialized care, that there's some companies that have virtualized those 100%. And so an example would be, and these, I think technically, in the lexicon of healthcare fit in primary care, but they're specialized, right? So if you look at, you look at some of these organizations, like a Hims and Hers or a 30 Madison, organizations like that, a lot of people wouldn't consider those healthcare companies, but when you look at what they're doing, whether it's hair loss or it's sexual health, or they're getting into migraines and allergies and things like that, they're doing an intake process. They're diagnosing what's going on. They're handling it in an async way. There's a provider on the other side, and then if you need the treatment, then the treatment shows up. I think those are examples. I think you're going to see more and more care of that specialized care move increasingly online. There are certain things where you're going to need, to go into a clinic to get a scan, to get a procedure done. So it's not all going to be digital, but I think you're going to see more and more of that happening. And as that happens, then those types of specialty care will become more shoppable, and I think will start to look more like that provider agnostic care I mentioned earlier.
And you're actually also seeing that in more serious stuff, like you mentioned migraine, but diabetes got some virtual clinics coming, and IBS, those sort of gastrointestinal stuff. There's Oshi and companies like that. So given that you're working for the dinosaurs, right? I'm not going to Dinosaur Preservation Society, but so we're talking about the big health systems who are under pressure and have this sort of interesting conflict. Conflict is the wrong word. Well, sometimes it's the right. Interesting relationship with their big payers, right? The Optum, and Optums, and the Elements of the world. Cigna, many of whom are getting into, and the CVS are getting into some level of primary care, and in some cases, capitated primary care as well. And so we have a lot of shifts going on. Where do you, just, this is kind of my last question on this sort of the patient aggregation thing. Where do you think that a company like yours, which is helping them get net new patients and then operate them through the system, how important are you to them compared to all the other ways that traditionally, big hospital systems are selling all the stuff they're doing, which is obviously mostly specially driven and inpatient or intensive outpatient driven?
Yeah. So the interesting thing about dinosaurs is, I can look out the window and I see a lot of dinosaurs, birds still flying around in the air. So
they've evolved a lot. I'm not
evolved a lot, exactly, which is exactly the point. Exactly the point. So health systems. So first of all, as you know, Matt, you've been in the space a long time. Healthcare is still very much very much a local kind of business, right? We're in our communities, and yet for all the virtual stuff we just talked about, you can do online. If you ask people, who are the hospitals in the area, right? They've got the 3 or 4 in their community that they know about, and most of those organizations own, they've gotten the religion on ambulatory care, and they own ambulatory settings, and are doing all of that as well, to try to make care more convenient. So, and then at the same time, you kind of went there with kind of the specialty care, particularly when you go like the academic route or places like that. Just when things get serious, right? The quality and the seriousness of care that needs to be delivered, there's just not another place to get it than health systems. Now, a lot of care doesn't need to be delivered in a big, giant hospital, right? But we're all going to have 7 surgeries on average in our lifetime, right? And I know that from my last company in the surgery space. So there's serious stuff that health systems can provide. So the question becomes, all right, how can health systems take those benefits and then apply them to this new way of accessing care, consumer driven? Providers have choice and flexibility. They can be gig workers, in this particular area versus another, and it's financially challenging for health systems. So, the way we look at it is, you don't get a pass as a health system. You got some pretty significant advantages that you can leverage, but you've got to also add to that the game that these disruptors, I think, that you're talking about, are bringing to the table as well. And so the way you do that is you ensure that you have your care options are discoverable in the same places that those organizations operate, and where just humans these days spend their life and look for things. At the same time, you've got to ensure that it's, to use some e-commerce terms, it's sort of merchandised correctly, right? So the right things go to the right people at the right time. And then you've got to ensure that you're able to match up your resources and your capacity in a way that allows you to do this effectively. And I think health system, what we certainly find in the health systems we work with, and we work with health systems around the country now that cover about 20% of the U.S. population. So there's some scale. They don't all go through Dexcare experience, but they could if they wanted to. What we find is that the organizations that are doing it right, and we think are going to win, are combining the best of those worlds, right? They're taking their brands, their capabilities of delivering significant care, and then importantly, they're not ceding the top of the funnel for low acuity care as well. They're getting out there, they're making sure that they're in the places where people are looking for care. They're making sure that their call centers, where a lot of people come in, also understand the best match, are powered by systems like Dexcare to understand that those reps understand the best match and where they should be putting people. And they're also doing it in a way that makes life just tolerable and bearable for their providers, because they're serving the patients that they want to serve, and they're doing it in a way that actually makes the business of healthcare work as well. I think the more organizations that do that versus what, when you refer to kind of traditional way, when I think of traditional, aspects of a health system, the way they would do this, it's, we all think of an ad on the side of a bus or a billboard,
right? Yeah.
Or we'll just send it to
every baseball team in America sponsored.
Yeah, we'll just send it to the first available. Yeah, I mean, you just got to be more. You got to be more kind of technically savvy and intelligent about this. It's not like I would never say health systems should try to out-consumer Amazon, but health systems can ensure that they're in the same spaces and places where consumers can discover them. And then health systems have, again, the advantage they have is they have the people that actually can deliver care, and they have that history. And so if they can connect that to it, then they can provide ultimately a better care experience than a large disruptor can.
Yeah, I was actually interesting. You mentioned Amazon. Obviously, Aramotic was at Providence when you got there, and now back at Amazon. And I actually thought they were going to have a real go at health systems. And I think there was some different concern from health systems about it. And it turns out they kind of gave up on that. Bought the primary care group I'm a member of, One Medical, and which has got a very tight relationship with a bunch of these systems in our town at TCSF. in San Francisco, and somehow they managed to get paid UCSF's rates for their primary care, which I don't know how they got away with that, but well, I've done some work on comparing their billing, going, how are you managing to charge this much when the step down the road is getting a quarter of the rate? But that's a separate topic. Let me, so I don't know. So and the other thing says that the health systems do, I kid that most of them they're really hedge funds which do a bit of healthcare services on the side, right there. So many of them want so much money, it's going to take a while before they, the dinosaurs, the meteor hasn't hit them yet. It's not badly enough. Let me switch gears a bit and ask you about, the middle part, the engine of the business. You mentioned the sort of the operating system optimization part that helps figure out what's going on with the EMR, with the patients, with the providers, and the system-wide stuff. I'm going to throw some names here. There's a lot of money invested by VCs in companies that are kind of attacking this kind of space and assigned to health systems. So I'm going to throw a bunch of names at you. You're going to tell me if they're direct competitor, they do something different, or they do some of what you do but not the rest, or just give me a flavor. So first one I'll throw you is Qventus, which I keep talking about its operating system in healthcare. Do you see them? Are they?
Well, let me kind of,
and you just give me a quick.
Yeah. Well, I was going to make a broad statement that I think will also help with all of them. You've been in digital health long enough, Matt, to know like it's all one big Venn diagram, right? So anybody that says it's completely white space is not being honest about the space. So there's always some overlap. Like a Qventus. So where we don't have the overlap, right? And you're probably going to get to like some scheduling companies and even EMRs and things like that. Is our secret sauce is really focusing on the front end acquisition piece, right? So all the way to the point where we bought a company in the e-commerce space that actually still to this day works with some of the leading retailers in the world. Don't even sell healthcare, right? Like they work with Harley Davidson. They sell leather jackets online. They're building shopping cart technology that when we find something that works, we then move it over. We swap out the leather jacket and we put in the doctor's appointment in there and we merchandise it using that technology. Those are kinds of things that sadly are just not, they're not used by a Qventus. They're not kind of part of the DNA of healthcare yet. And then the other piece is this capacity optimization piece. Most folks, when they think of access, they tend to, I say this, I think it over-indexes a little bit on, consumer preference and all the things that, just give the consumer what they want, right? And I think that's one part of it, but so is what's going on with provider and health system as well. And you got to pull all those together to actually make an access experience that works for everyone. And we just, we don't see Qventus doing that on the front or the back end. And I suspect the other names, I think I probably know the other name.
I'll give you the next two, which are sort of scheduled with this, which is Kairos and Lumina. Are they? What compare and contrast to them?
Yeah, exactly. So again, you end up with a sort of a similar solution. So Kairos, and I've got a lot of respect for Graham and that organization, what he's built over the years there. They're doing very smart. They move into the payer space with the HealthSpark acquisition. Kairos is very effective as an organization once you kind of are in the digital realm of the health system, their web and their app, et cetera. And again, if you're going to optimize around kind of patient preference, right? But we help health systems get a lot of new patients. And so you can't be, we find, I'll give you a stat. We have a large health system. Of their digital traffic, 90% comes from Google, a little bit kind of from what they promote. 10% is what goes to their website to search, right? So if you're a Kairos and you're owning that search space in the website, well, that's good for that 10%. But what about the 90, that are looking for you out there? And then the flip side, and then the other side is, again, I think they're good at sort of traditional, sort, browse, filter, consumer preference. Important, but it's not any good if, I as a consumer end up choosing some person who is, burnout and going to leave the job because they're seeing too many patients with the wrong ones, or I choose a service line that is underwater, and when the health system could have me see somebody else that actually could do just as well and save me some money. So Kairos doesn't really kind of expand to those other areas.
And then the other subgroup is the companies doing kind of patient outreach messaging based on care. I think like Memora, I think Altera, which has changed its name from it was called Well something before. Yeah. Space. There are a couple others as well. Is that something that you guys get into or not? Is that...
Not really. I consider that kind of the patient engagement space. Again, it's a Venn diagram, so there's some overlap. But like Memora, since you mentioned, they're also we're backed by the same investors, have a huge amount of respect for Manav. Those organizations I think are really good at kind of those ongoing comms, or like an upfront, Ben over at Upfront, places like that. They're really good at that kind of those ongoing comms. We're much more focused on let's help the patient find you. And then let's ensure that you've got that right match of resource to, supply to that demand. And then we're just going to get out of the way until they need care again. There's other people better equipped, like those organizations you mentioned, to handle that ongoing management.
So let's big picture. You've got a bunch of, I mentioned some of them, obviously Dexcare in the middle of this, others, you've had all the organizations that you work at have spent a gazillion dollars, a multi-billion dollars plus putting in Epic, or maybe some cases, usually Epic, some cases Cerner over the previous decade. They've usually built a bunch of specialist stuff, clinical decision support stuff on top and all the rest of it. And have probably not thought so much about the patient experience or the clinician experience as much as they would like to have done. And we've had a lot of discussions about that and getting the data out of it and all the stuff that you're kind of doing, right? It seems to be the last sort of 3, 4, 5 years. Excuse me. We've now got the whole promise of, we're going to use AI for whatever the hell AI means to deal with this data and get better answers and quicker and find more patients who need care. And, I've heard any number of pitches about this in recent years. Where do you think, if you think about, okay, we got the EMR in by, say, the mid-teens, and we started, using it. Patients now are starting to use their portals. They don't love it, but they're starting to use it. We did that sort of really Web 1.0 thing of 20 years later, 15 years later than the rest of the world did it. How is the health system industry? We talk about, dinosaurs becoming birds. How are the big health systems doing and kind of taking on things like Dexcare and other tools to kind of automate the rest of this stuff, like the e-commerce world stuff? Where are you in that process?
Yeah. So, we've been seeing it pretty real time. So this system, as we were talking earlier, has been in production for several years now. If you go all the way back to what was a sort of project inside Providence Health System. And, when I joined, which was literally right when the pandemic got on our radar screens in 2020, you saw it. We all lived through it, right? There was this whiplash of nobody can go in person anymore, and now it's all going to be virtual. And then it was the virtual is not such a big deal. Now let's go the other way. And so I will say, like, it's the pace of change has been pretty dramatic over the last 2.5 years now, since we've spun out. It's turned out, and these things are always a bit of luck as well, right? Like Dexcare's turned out to be made for this moment, in that care has gotten more complicated because it's multimodal. It's almost like, right, we're not all doing virtual care, but like 20% of it is now, which is 10x what it was before. So it's a number that you have to pay attention to it if you're in the health system space. But at the same time, you got to still do all those clinics, you got to do all the analytics, you got to do all that. So it's gotten a lot more complicated, which is again why you need kind of these orchestration platforms like Dexcare. And what I would say the most satisfying thing that's happened through this process of the last couple of years is that I finally feel like I've seen it, like the health systems are like finally serious about this stuff, right? There was a couple of years ago when we would compete for business, it was there's 50-point solutions that are also competing for this business, and some small budget in the health system is signing off for this pilot here and another one over here and this pilot, another one here. And that's really hard to just stress and just, exhausting to run a business through when you're trying to kind of, you lay out this platform play, like we have. And what's happened in the last couple of years, it's gotten rationalized to, okay, these digital transformation efforts are material now. We can't just check the box anymore. We have to do these things for some of the reasons you mentioned earlier, Matt, with disruptors and all that kind of stuff. And consumers want it, so we've got to be serious about it. We need to make sure they amplify and work with our existing infrastructure. You mentioned EMRs. There's also, CRM is meaningful. I mean, I think, like, as far as big tech goes, I think Salesforce is doing some of the most interesting things in healthcare right now. So it's got to work with our identity systems, got to do all this stuff. Like, there's finally, like I've seen the last couple of years, there's finally like this appreciation. We're gonna put it at the service line level. The organization, we work with lots of people inside the health systems. Probably the most influential is the person who owns the service line, who is on the hook for growth in that service line and cost management, and owns all the providers in that space. So there's just a seriousness and a gravitas that's been put to it now. That is, on the one hand, if I think if you're not well capitalized and you're a point solution, I mean, it's challenging to be in that world. And I think that's, where a number of digital health companies are right now. But if you're able to play that game, it's great, because now finally people are getting serious about it. Now, does it mean that health systems are going to be able to get through, just the barriers and the inertia that is healthcare that we're all familiar with? It's probably always going to be X number of years behind e-commerce and the other spaces that I've been. But it's changing, right? Like, or maybe another way to say is, I don't feel like, how about this? I don't feel like the gap is widening anymore. I feel like it's steady state. And then just to hit, finally, you mentioned generative AI. I mean, us included, but not just us, I think more importantly, every health system we work with, the digital offices of those health systems are employing engineers, utilizing these technologies mostly for kind of prompt management and kind of automated filling out of forms and things like that. But they're employing engineers to build product or build functionality, leveraging these technologies to implement within the system. I think that's remarkable for healthcare. Not like an e-commerce company, but that's remarkable for healthcare. So, I don't think the gap's getting bigger, and I actually think it's getting a little smaller now, which is a good thing.
Interesting. Very good. All right. Just before we go, let's a quick wrap on the state of play at Dexcare. So you're up to 170 odd million in, right? 145 million odd in revenue with the revenue. That'd be great. Not revenue, in capital raised with this new round from like Transformation and Prosperity and Define, some other big names in there before. Where are you in terms of number of employees? How many customer systems? How many people running through the system? What's the usage like? Give me a sense of where you are, and you can tell me if you like. You do get very scared, but where are you in terms of like where
you're trying to get it?
That growth trajectory.
You're trying to get a sense for scale. So we don't give out revenue or customer numbers, but I can tell you that we work with health systems now. We cover about 20% of the U.S. population, about 57 million consumers and patients that have kind of access to Dexcare powered experiences. I should have mentioned earlier, by the way, as a consumer, you'll never see, or a patient, you'll never see a Dexcare experience. They're always to the health system. The health system is our fiduciary. So that gives you some sense for scale. They are, we're in terms of growth. The company has been pretty much across all measures, whether it's ARR, revenue, people, all of those things have increased. They've been more than doubling every year.
How many people are you roughly now?
We're at about 170, I think, at this point, 160, 170. But that's been growing. There were 20 when we spun out of Providence, so it's been growing. That was 2.5 years ago. So that trajectory has happened on all the fronts. And then the other stat that I'm just incredibly proud of is that the health systems we work with, because we can help them find 20-30% net new patients, because we can increase capacity 40%, because we can do those things, and the patient experiences are 90+ NPSs, we've been able to continually increase our relationships with them. So, people look at like net revenue retention, how many organizations are working with and do they keep working with you? And we're at like 170%, meaning our customer base continues to want more and work with us. And that's because we've I mentioned at the beginning, this platform started kind of low acuity provider agnostic care. Because it works so well in those settings, we've now expanded into a number of specialty settings. So we have a health system in the Midwest where we partner with them in one of the leading cancer centers in the country. We're focused on oncology with them and kind of screening and pre-screening and things like that. We've got an orthopedic group at a major health system in the northern Midwest. We work with on that front, behavioral health. So we're moving into all these other areas as well that we just didn't have. It didn't have a while back.
Fantastic. Well, that's really great to hear, and I think we've had a really interesting discussion here about the breadth of how health systems are adopting to this new technology and how Dexcare fits into that. I've been speaking with Derek Streat. He's the CEO of Dexcare, just raised another round of 75 million from Iconic Growth. Derek, thanks for your time and good to hear how you're doing.
Thanks, Matt. I really appreciate it. And it was great to see you. And you gave me a new analogy I hadn't thought of with the dinosaurs and the birds thing. So I'm going to start using that one now too.
All right. Well, 10% for that one as well.
There you go.